Good evening, everyone. Welcome. This is Brooklyn
and Sabrina coming to you from Care TV. Tonight, our focus is on impacts of work stress in nursing profession. We will dive into the causes, concerns, and ways to make change.
While we tackle these systemic issues, in the meantime, we should all learn more about self-care. According to a study conducted by Snyder in 2020, data from 149 students collected throughout 4 semesters. Self-care can help tremendously. In this experiment, at the end of each class, the last 10 minutes were used to introduce new self-care activities and positive coping skills.
Yeah, I can say as a nurse myself, I can't tell you how many times I've gone in for my shift and been told that, there's only 3 of us here tonight.
Oh yeah, that'll do it. I too have had some stressful events as a psychiatric nurse, but thankfully with the strategies that we will learn about it tonight, from our special guests, we will discuss significant outcomes referring to how self-care is essential to good mental.
The purpose of the study was to determine whether self-care strategies, when implemented, could have an impact on work-related stress and overall mental state. The study is both quantitative and qualitative study, peer-led, and is composed of nurses from both private and public sectors. The results were incredible. Participants saw an overall improvement in mental health state, stress levels, and recorded them as reduced.
As they would. Self-care activities have helped undergraduate nursing students as well as reduce their stress levels, burnout, increasing retention, as well as improving student and patient outcomes, which is revolutionary for our healthcare system.
Couldn't agree with you more, Brooklyn. I was introduced to meditation by a fellow colleague who was on the brink of breakdown during the COVID-19 outbreak. Since then, I've incorporated these stress-reducing strategies, and I've seen a significant change in my overall health. I'd wake up feeling refreshed and recharged and ready to tackle my day. It's been researched that related stress, if not managed, can lead to burnout, depression, and compassion fatigue.
On that note, please welcome a nursing student who is a part of this study and who's on her way to healing herself and others, Sydney Menard. How are you, Sydney?
Hi, thank you for having me. And honestly, regardless of working through the pandemic of COVID-19, I can't complain, and I'm just excited to be here.
Sydney, I know that there are a gazillion reasons why one would want to become a nurse, given our current state of COVID-19 vaccination mandates, hospital shortages, and the list goes on. What would you say made you decide to become a nurse?
The reason I have decided to become a nurse is that I've always been intrigued in the healthcare industry, and nursing is a high demand career, and I'm always looking for a challenge, especially since COVID hit us like a truck. I enjoy learning new things, which include wound care, treatment, and medication. And I am willing to provide adequate care for my patients and make sure they are as comfortable and safe as possible. I've also always been patient and compassionate when it comes to people, and I believe to become a nurse, those traits are highly required.
Very inspiring. I think there are a lot of people who see it that way, and I think that's very important. Next, we have some questions from curious people all over Canada pertaining to your career. Is that all right with you?
Yeah, that's perfectly fine. Ask away.
So this question comes from Lucien from Montreal, Quebec. And the question is, in your opinion, what is the major cause for poor mental health and burnout in nurses?
Unfortunately, the primary cause of nurses having poor mental health, often ending in burnout. Unfortunately, nurses are understaffed, and in hospitals and other nursing facilities, there are shortages, and nurses work overtime, they work long hours, and they are undercompensated. That does put a strain on nurses who also have responsibilities outside of the workplace.
Our next question is from Amanda from Toronto. What are some self-care exercises you use, and how often do you use them?
So my self-care activities include going to the gym at least 3 to 4 times a week. I do enjoy taking a bath instead of a shower after work. I do that at least twice a week. I also enjoy listening to an educational podcast. I enjoy reading books, and I enjoy spending time outdoors. I like going for walks, hikes, or even a bike ride. I believe that every healthcare worker should take the time to do self-care activities to improve their mental health, just by visualizing the worries of their day and just watch it all disappear down the drain when they take a shower or a bath. Do some journaling, or even enjoy your favorite form of entertainment. These routines after work can improve sleep quality and just remove all the negative thoughts and feelings.
Well said, Sydney. The next question comes from Karina from Halifax, Nova Scotia. What are some factors that prevent people, including nurses, from accessing mental health services?
Some factors that prevent people from accessing mental health services can be from stigma or negative experiences in the past, which prevent people from trusting healthcare workers. Some marginalized communities are also more hesitant to access healthcare services due to the negative experiences in their past or from intergenerational trauma. Sometimes parents or guardians can be the reason why they refuse to take their children to these services.
Well said. Christopher from Charlottetown in PEI asks, have you had a coworker that experienced mental health
trouble? Yes, I have had a coworker in the past have trouble with her mental health. As a team member, we need to ensure that our coworkers are being checked in with and encourage them to take their breaks and offer your help as much as needed, and even report to your manager if it's required. Doing wellness checks are important with your coworkers because it improves their mental health situation. We also need to remember that it's the small things that matter the most in our healthcare environment.
I like how you said that. Checking in with your team. It's too easy to lose sight of our coworkers' mental health. In order to provide the best care, we must be at our best. And that goes for whatever field you're in. Sydney, I want to thank you for joining us today and for sharing your valuable experiences with our viewers. I know I've gained new perspective on issues affecting nurses today, such as poor mental health caused by staffing shortages. Now I have extra tools to add to my current regime. When we come back, we will hear from Tristen, who is currently at St. Catharines General.
Thanks, Brooklyn. Thanks, Sabrina. You are so right. Taking care of ourselves is extremely important, because without that, you would not be able to help others. I am here at St. Catharines General, where everyone in the surrounding area comes to get checked out when they are not feeling well, whether they're having a heart attack, had a stroke, or even had some broken bones. The staff here has been working around the clock and then some to ensure that everyone gets the best care they need. However, I am here with nursing student Pinder Gill, who has been working and learning at the hospital, who says that patients may not be receiving the care they deserve.
Thank you, Tristen. It is becoming increasingly difficult to gain nursing experience in the hospital setting as a nursing student due to the severe lack of adequate staffing. Nurses are finding it impossibly difficult to provide adequate care for their patients, much less being able to mentor new nurses like me.
Yes, we have a survey that was conducted by We RPN, an organization representing the voices of RPNs, addressing the current state of nursing in Ontario. In this study, Diane Martin, Chief Executive Officer at We RPN, sounds the alarm about the unsafe workload that has been normalized in the healthcare sector.
Yes, I've heard of this study. It shows a troubling trend of growing systemic inadequacies in the healthcare sector that are contributing to lower and lower retention rates in nurses. This low retention has caused the situation to spiral out of control as the COVID-19 pandemic has put pressure on the faults already present in our healthcare system.
According to this study, the staff and resources shortages have left 68% of nurses feeling they are unable to provide adequate care for patients. In a letter describing how staffing shortages have affected their hospital visits, a patient told Martin that they had to wait up to 40 minutes for bedpan only to be told to go on the bed and the staff would clean it up afterwards because they are too busy.
Tristen, I believe it is due to these conditions that moral distress is rampant in nurses. 79% of surveyed nurses felt they were asked to take actions that were not ethically correct. As expected, this workplace stress has brought most nurses to a breaking point. As a result, currently half of nurses surveyed by WeRPN were thinking about leaving this profession.
Well, Pinder, what can we do to change this dire situation?
Well, I agree with Diane Martin on this. First off, we need to address Bill 124. Bill 124 that came into effect August 8th, 2021, limits the annual salary increase for nurses to 1% annually, among other professions. This is not even close to keeping up with inflation rates. With 75% of nurses experiencing financial stress, it is paramount to compensate the wages of the people who take care of us when we are being born, when we are sick, and often when it is our time to go.
Yes, we must pay our nurses fairly for an incredible work they do every day. These people who take care of us throughout our lives, what do you say is the biggest challenge that is faced by nurses today?
One of the biggest challenges nurses face today is normalization of these unsafe and inhumane conditions for both the patients and the nurses. It is very important that we fight back against the sentiment that institutional management and policymakers may hold. It is our duty as nurses and members of the public to protest this sentiment in the media and in our politics. We must make sure that the voices of nurses are being included in our policy decisions. One of the biggest responsibilities of nurses is to advocate for the health of the community. And for nurses to be able to provide the exceptional care that we all want to receive, we need to compensate them fairly, and their voices need to be heard. It is clear that lawmakers' priorities lies elsewhere.
Wow, those are some compelling words from Pinder. Yes, I believe that we should protest these unfair wages and inhumane working conditions that nurses are having to deal with. I guess the point to remember is that self-care can significantly reduce symptoms of mental health problems such as stress and PTSD. However, it is important to address the underlying problems nurses face at work, such as staff shortages, unsafe workloads, and stagnation wages. This leads to lower quality of care. I believe it is up to us to advocate for our patients, ourselves, and our colleagues. To this end, we should all protest these problems that nurses are having to deal with. That's all the program we have for today. I want to thank you, Pinder, for a lively discussion about current situations in the nursing field. That's it for us tonight on Care TV. Thank you all for coming out, and remember, the most important thing to do if you are feeling stressed or burnt out, look for a positive outcome that will help relieve those problems, and to look for someone close in your life to help you along the way. There is always people out there to talk to as well.